segment. And
today is Sunday.
yes. Welcome back to the second segment. If this is actually your very first time of seeing my face, my name is Anu Adekunle from Oyo State, Nigeria. I film about mental health, lifestyle, and events. And if you have been following this series, thank you very much. Thank you so much. Please, if you are not subscribed, please subscribe and do well to click on the notification bell so that you will be the first to be notified.
Help us to reach 4,000.
Abi, you help us reach 4,000. 4,000.
One.
At
least with this video first.
Oh, alright. Help us reach 1,000.
Yes.
So I still have Dr. Adebowale with me.
Thank you.
And now would be answering your questions. The questions, I know these questions are from your heart. I just picked them one by one. And I'm sure that you'll be happy at the end of this segment. So the first question I want to ask is actually about contact lenses. Because I've been to makeup studios where I was told, Auntie, after your lashes, let me just put contact lens for you. You'll be so beautiful. And because of the kind of eye that I have I have this very teary eye. I usually tell them no, thank you very much. But I've seen contact lenses on people and they are really very beautiful with it. And I just want you to tell us, must contact lenses be prescribed? And then what's the harm? Is it like there's any harm in using contact lens and stuff like that?
Well, for me, I like contact lenses. It's a very big area of optometry, and it's also a subspecialty in ophthalmology. Because in the UK, in the US, they have contact lens specialists. So for you to know that you have a contact lens specialist, that means that it is something deeper than what appears at surface level. So for me, I wouldn't fit contact lenses with a person who is not qualified to do so. Just the same way that I wouldn't allow my child to be birthed by an outsider. I wouldn't take my pregnant wife to go and take delivery behind the back. So contact lenses is a very big specialty and it shouldn't be taken lightly. Of course, I've seen people who go to fashion stores, they get their contacts and they come out unhurt. But we should understand that contact lenses, when it was actually formed, the aim of the contact lens was to have a form of refractive power holder that you can place towards the surface of the eye and help the person to see. So if you're using contact lenses, it means that this foreign object is going to be in contact with your eye for you to be able to see things. And anything you're going to be bringing very close to your eye, you should be able to have some sense of duty that you are doing it rightly, because you have just two eyes. If anything goes wrong, well, you have one that can act in alternative, act instead of the other. But you should actually be very careful, because as beautiful as contact lenses can make some people, it can also make some people's lives miserable, because you don't want to have any complications from contact lenses. Contact lenses can have lots of complications, so you should be sure that it is fitted well. When you're getting a pair of contact lenses are not like one-fit-all lenses, meaning that you just give person A contact lens and expect that that same contact lenses will work well for person B, because contact lenses usually should sit on the person's cornea, and some people's eyes are larger than other people's eyes. So when you go for a contact lens fitting, measurements are always taken. So if wrong measurements are taken, it wouldn't work well for the person. So also when you're wearing a shirt, you wear your sister's shirt sometimes, but that doesn't mean that it sees your size.
Mm.
And when you're wearing a contact lens that is actually not your fitting size, you would have problems. So that is about that. And there are various types of contact lenses. We have contact lenses that are to be worn for that particular day, and you throw it away after using it. You are not supposed to wear that contact lens again. Those contact lenses are called daily disposable contact lenses. And secondly, we have daily wear contact lenses. Such contact lenses are to be worn while you are awake, such that you wake up in the morning, you put on your contact lenses, you go to bed at night. Before you go to bed, you remove the contact lens. Then there is the extended wear contact lens. Such contact lenses can be worn for a period of days. Why? Because they have the ability to take up water. So if a person wears contact lenses, that is a daily wear contact lens. Or let's say, for example, you wear contact lenses that is a daily disposable. You wear it that day and you wear it the next day. What do you think will happen?
Limitations.
Yeah, because that contact lens is supposed to be worn only for that day. So also a daily wear contact lens. If you wear a daily wear contact lens consistently for more than a day or two, you're also going to have complications in that eye. So you have to know the exact kind of contact lens that you are going to wear. And also there are two types of contact lenses. There are the soft contact lenses and there are the hard contact lenses. Of course, the hard contact lenses are not as popular here compared to the soft contact lenses. The hard contact lenses usually are used in solving problems that the person may be having. Maybe the person is having a very large astigmatism, or the person is having keratoconus. There are some people that the eye, this black part of their eye, let me put it that way, but it's actually the cornea. The cornea is transparent. That transparent membrane, which is the cornea, begins to bulge out. It's a very painful condition. So with these hard contact lenses, it pushes the cornea backwards to enable the person see well. So these are the kinds of two materials that we use for contact lenses, either a soft contact lens or a hard contact lens. And also, before you get contact lenses, you must be aware of why you're using the contact lens. Are you using it for fashion purposes only? Are you do you have refractive error? Can you see very well? Are you going to be using these contact lenses to see very well? These are the reasons why, very tangible reasons why you must consider wearing contact lenses first. And also, there are some eye conditions that you need this contact lens to act like a plaster. You know, you can't really deliver drugs to that place, but you've seen bandages whereby it has some little drugs in it, they just placed on the surface of the wound. So also with contact lenses, there are bandage contact lenses that you place on the surface of the eye so that it can speed up the healing in that person's eyes. And lastly, there are people who are eye allergic and there are people who have dry eye. These people are bad candidates for contact lenses. For example, you fit a contact lens into someone who has lots of allergies. The person is never going to have a comfortable wear with that contact lens. The person will keep coming back with red eye, with tearing. Sometimes will come back with abrasions and the likes. So also, if a person is not hygienic, contact lenses demand 100% hygiene because they can easily have bacteria when you're using your dirty hands to put it into your eye and the likes. It can happen. And it's also not for careless people. There are some people that go out without their contact lens solution. So you want to put on your contact lens, you've removed it, then you want to put it on, you're not cleaning it, you just put it into your eye like that. You're on your way to a sorry case.
I've seen somebody that used only water now.
That is one of the most dangerous things you can do for your eye. Because if you use water, especially maybe tap water or any kind of
She
water,
actually used pure water. We were in lecture room and then I think
such persons can be predisposed to what we call an acanthamoeba keratitis, and is one of the most difficult kinds of keratitis to treat. Because once the person has such kinds of keratitis in the eye, it works very fast, such that the movement of the organism from the front part of the cornea to the back part of the cornea is very fast, and most times they may lose that eye. So if you're using water, I've seen a scenario whereby the lady used Coke to actually wash her contact lenses, and by the time she came, it was a sorry place for her. And most times, because the contact lens is sitting on the cornea, and the cornea does not have any blood vessel. If you tear your hand now, you'll see blood coming out. If you tear your cornea, blood will not come out from it. So if there is any complication to that cornea and is not treated on time, it results into a permanent opacification. And when you say permanent is permanent. The eye will not, even if you feel less symptoms, you may not be able to see very well with that eye again. So if you are going to be fitting a contact lens, you should see an optometrist for you to fit your contact lenses. If you are not fitting your contact lens with an optometrist or an ophthalmologist, I think you may be doing a lot of harm to yourself.
You've heard that too. I've said my own.
Indeed.
So I actually saw a picture during the week, and it's quantum polarized healing glasses. They say it heals all eye and head, even hair defects, migraine, headaches, mental and nervous issues, and then they said activating cell tissues around the head region, promoting micro blood circulation speed.
It's a miracle glasses.
So how true is it? How true it is it? And then another question that I would ask with that is, all these people that I have a friend that sells these glasses that I was recommended with a photochromic pair of glasses. She said everybody should have that because of the kind of age we are in. So she sells it without prescription or anything. She will just give it to you that once you want to press your phone, once you want to use a computer and stuff like that. So what can you say about things like this?
Well, I've actually seen a lot of people go online, take advantage of the internet and the likes to make some claims. Sometimes those claims can be right, sometimes they can be wrong, but because they are claims that are made by people who are not licensed to make such claims. For example, I can't go to a court because I'm not a lawyer. I can't be received by a judge because I've not been called to bar. So when you get advices from people, you have to be actually sure that the person you're getting an advice from is actually the right person to get the advice from. Do you understand?
Yeah.
For example, now somebody can come to you as a lady that, oh, you're having menstrual pain. Use Felvin now. Use diclofenac. Use ibuprofen. Of course, the person is having pain. Diclofenac may work for pain, but you can't tell every lady to use diclofenac. If you're telling every lady to use diclofenac, if that lady has ulcer, you may be sending that lady probably to an early grave or to a very to a very unpleasant situation. So who are you taking advice from? What does this person actually know about these things? So for example, the first question, there is no glasses that cures any kind of disease, because glasses, first of all, are not meant to treat diseases. They are not meant to treat diseases. They are only meant to take care of refractive errors. Glasses does not do anything to your body. When you get injections, you get drugs, the glasses alters some things inside your body to produce the drugs rather, they alter things inside your body to produce a result. But when you use glasses, what glasses does is that light is entering into your eye. Light ought to fall at the back of your eye, which is the retina. So the light either falls before, which makes you a myopic or a short-sighted person, or it falls after, which makes you a long-sighted person or an hyperopic person, or it falls on double points, which makes you an astigmatic patient. So when you use glasses, these glasses now refract this light and helps it to fall at the right position. So the only thing your pair of glasses will do for you is to reposition that light so that you can see better. So if you are having strains, eye strains, headaches as a result of your muscles trying by themselves mechanically to adjust the focus of this light, with a pair of glasses you will be relieved. A pair of glasses that has power, you will be relieved. So that is that about that. But glasses now helping you to solve headache, migraine, glaucoma. It is unreasonable that with glasses you now solve all kinds of headaches, all kinds of cataracts, all kinds of diseases in the eye. Even if they tell you, even if they tell you, because you said what?
This one added years. They said
it solves eye and ear defect. Wow, that should be magical. Because if someone is even selling that to you, you should actually be afraid that what exactly am I getting into myself? There is no such thing as one drug for all. I've seen people those days when I was in Benin, around Ring Road area, they will tell you one drug helps you to solve all forms of sexual problems. Solves if you have fibroids, just use the drug. If you have staphylococcus aureus, just use the drug. So in eye care, you can have 10 symptoms, or you can have one symptom rather, and it mimics about 10 diseases. So how do you solve such things? It's preposterous to say that you get a pair of glasses. Is an insult to your intelligence if you actually buy that sort of a thing. And also, a person saying that when you use a photochromic pair of glasses and you use your phone, actually the person is having an incomplete knowledge, because a photochromic or a transition pair of glasses works with ultraviolet rays, not with digital rays or visible light. Ultraviolet rays, when they come in contact with the contents or what has been used in making a photochromic pair of glasses. A photochromic pair of glasses is made from silver and chloride formation. Okay, so when these stuffs are made, they are made as a compound, but when they come in contact with the ultraviolet rays, they dissociate. So it's in the dissociation that it absorbs the UVA and the UVB rays of light from the sun and becomes dark. So when the person is not exposed to ultraviolet rays, the pairs of glasses are clear. But once you're exposed to these ultraviolet rays, it becomes dark. For example, photochromic pairs of glasses don't work when you're in vehicles, because your vehicles themselves, the windshield, are UV absorbent. So when you're wearing a photochromic pair of glasses in the thick sun, it won't respond to the UV rays, because the car windshield is already blocking these light rays. So once you get out into the sun or exposed to any minimal light from the sun with these ultraviolet rays, it goes dark. So what helps you with your digital devices are anti-reflex pairs of glasses. However, some photochromic pairs of glasses comes together with this anti-reflex. So that's why you go to an optician and the optician tells you that you can get a photochromic AR lenses. So these photochromic AR lenses, many of the times, they come together. So if you use a pair of photochromic glasses, is there enough to relieve you of any symptoms, or is there enough to help you with your phone? Of course not, because there are lots of things that dictate how well your eyes function when you're looking at your digital devices. First, if you have an uncorrected refractive error, you must solve this refractive error before you can actually have a good vision. And also, if your two eyes are not working properly, because there's something called phoria. What what's an extreme case is called strabismus. You can see people that one eye is looking this way, the other eye is looking that way.
Yeah.
In people, almost everybody have a mild form of that. It's when it becomes manifest that it now dissociates. One eye goes this way, the other eye goes that way. But usually everybody has a mild form of these things. So how well your eyes are working together and the reserve that is present in your binocular vision must also be measured for you to have a comfortable vision, especially when you're using your phone and you're using your digital devices, your laptops and the likes. So all those things must be looked at holistically before you get a pair of glasses that now has an anti-reflex or a blue cut feature. If you're using just a photochromic pair of glasses and you think you are doing yourself a favor when you're looking at the system or looking at the phone, actually you're not doing yourself enough favor. Do you understand? You're not doing yourself enough favor. It's an incomplete treatment. So when you go to see an ophthalmologist or you go to see an optometrist, all those things are assessed, and the photochromic and the other one is now added as a feature, because these are actually not the reason why you're having your headaches or you're having visual discomfort when you're using your system. You're using your system and you're having these symptoms. Check your refractive error, check your binocularity vision, your binocular vision. So these are the two things that are very much important.
Yeah, so I want to talk about the constant use of computers, constant use of phones and everything. I've heard people, even professionals, talk about it, that it actually affects the eye. So how do you think we can cope? Because this generation, we're always with our phones.
Yeah.
I think I've even been embarrassed a number of times. Like, people of the other generation, when they see you with your phone, like, it's like issues for them. These men that drive cabs and everything, they just keep complaining. So how do you think?
Like you're always with your phone and the like.
Like, yes, once they see a phone, once they see you use holding phone, then that's the headache.
Well, I would say that it affects the eye negatively. There have not been any proven research to say that when you spend a lot of time with your phones and the likes, it damages some particular cells in your eye. I could remember that in 2016 or 15, there were some opticians in UK that said if you expose yourself to a lot of uh, light from your computers and the likes, it damages the macula. And the board, they actually sanctioned them for about £40,000 for giving out wrong information. Yes, the use of phone, because of the kinds of light rays that comes into your eye, can make your eye easily fatigued. Why? Because when you're looking at things, you are focusing, and there are muscles that are responsible for this focusing. So you're looking at this, my palm now, or you're looking at anything in your near vision, your eyes will take up a particular posture with the help of muscles. These muscles are prone to getting tired. For example, you can't hold, I'm holding my phone with the help of my hand. Of course, it's not heavy, but if I do this consistently for the next 10 minutes, I'll begin to feel some strain. So also with the eye. If you are an avid user of laptops and the likes, you are consistently postured in a particular manner. Before long, you begin to feel tired and you begin to feel pain as a result of this tiredness. So what you do is that after use of your computers, your phone for more than 20 minutes, you can look away to a distance of about 20 feet for like 20 seconds. So we call it 20, 20, 20. You look away afar after about 20 minutes for about 20 seconds. So that way you get to not overload or overwork these muscles in your eye. So you are always kept, your muscles are relaxed with at regular intervals. So that in a way helps you to feel less tired. And also, yes, the light rays interrupts your circadian rhythm such that people who press their phone into late hours of the night usually do not have a good sleep, which has been proven by lots of researchers. So when you press your phone for a long time, you're still pressing your phone till 9, 10, 11, 12. Chances are that you're not going to sleep well because this light rays coming from your phone interrupts with your circadian rhythm, which is a disadvantage. So what do? Keep your phone backlight to the barest minimum, especially at night. And that's if at all you know that you don't like to sleep or the lights early, make sure that your lights in the room is at least one. Your lights from your phone should not be the only source of light in your room at that particular time. Because the light rays, one, will get your eyes tired quickly and will interrupt the sleep pattern that you have. So with the use of this anti-reflex in addition to your prescription, I do not advise that you get just a pair of glasses that has no power, except your optometrist or your ophthalmologist has examined your eye and found no significant refractive error in your eye. Then you can now get a plano or a normal photochromic pair of glasses. But usually, almost everyone has a refractive error. So when you're using your pairs of glasses, make sure that it's a prescription pair of glasses, because that would be an holistic approach to solving the problems in your eye. So for people who spend a lot of time with their computers, people who spend a lot of time with their phone, after every 20 minutes, try to look away for like 20 seconds to a distance of 20 feet. And also reduce the backlight of your phones, reduce the backlight of your laptops, and let not your phones or your laptops be the only source of illumination in your house. Let it be even, such that the light from your phone is consistent with the light from your background and everything. So if the light from your phone is the only thing, it could be dangerous. And sometimes staying a long time in very dark environments is one of the reasons why people develop angle closure glaucoma, which is always an ocular emergency. But because of it's not a time for us to discuss very much about that. Thank you.